it actually helps prevent that inflammatory response, which is really interesting because we only think I need to use a vitamin C because it's an antioxidant. Yes, it's an antioxidant, but what's more going on?
Welcome to this week's episode of Beauty Babble. Today, we're talking about the best ingredients to calm sensitive and inflamed skin. Hi, Suzanne. How are you today?
I'm good, Doreen. How are you?
I'm good. Thank you.
So today came across an interesting article. As many of you know, we like to read lots, I guess. And I think when we talk about ingredients, sometimes we're not realizing how it crosses over into other things. So one of the, what we're noticing is a lot more sensitivity to skins, more inflammation into the skin. And so what ingredients kind of help the acid mantle of the skin and rebuild the skin and to calm it. And it's probably all in your products. And we always say, if you're not sure, talk to your product line educator or your distributor. Hopefully you have that connection with your professional line. If not, make the connection. It's really important. But yeah, so I think it's a good one because there's a lot of people with sensitive skin and inflamed. So you think of rosacea, you think of acne, you think of just rosy cheeks and or weather. We're coming into summer. There's a lot of people that aren't using sunscreens. So what's going on with their skins? Is there genetic side of this? There's so many factors to it, and people sometimes don't realize what's all involved in it. So I think, knowledge is power. So the more you know, the more you can have those discussions with your clients.
I think clients with sensitive skin are really hesitant to get services done, right? Because they're always like, oh no, my skin reacts to everything, or they're just more cautious. So, are you less likely to encounter clients with sensitive skin if you're not actively sharing your knowledge base? Like if you're doing a pedicure on somebody and you're talking, always talking to them, if you find out they have sensitive skin, having that knowledge base of like, oh, these products I use are great for calming or
Mhm.
whatever it may be.
It's so true because clients don't know what you offer if they only come to you for lashes or pedicures or nails or waxing. And, that's a huge part is, letting people know what you do. And some people I've come across that where they're uncomfortable. Like, well, I feel like I'm selling to them. No, you're educating them because, I remember, again, I sound always so old when I say it, but it's part of the training was like, you're an esthetician. If you are and you do everything, how do you let your clients know? You have to tell them.
Hmm.
Is there anything else you need? Did you know what else I do? And so I had it where, clients, if they came to me, it's like, oh, I'm going to ask Suzanne. She probably does the service. So it came to a point where they just would ask before searching out anywhere else, do you do this? And then
Hmm.
I'd say, I don't. I said, but I have someone I can refer you to. So I always did that kind of networking then as well. So I wanted them to think of me as a resource. So this is the same idea, and it takes effort. It's a hustle. We always say that it takes effort, and you need to do more and learn more, and the more you offer, unfortunately, the more you need to know, which is okay, but you just take it with a grain of salt. And if you're talking about all the time, then it becomes a little easier. You don't have to know exactly every little ingredient, but you know, back to the sensitive skin side of it, I'm sure that people have heard of hyaluronic and fatty acids and niacinamide, and we've talked about ingredients, but they do much more than just one aspect. I think we need to look at, instead of just grabbing the cream for sensitive skin off our shelf, it's like, hey, what's in it? Because is there something else in the mask that you offer? Oh, look, this mask actually has ceramides in it, which we know is an emollient and it helps with, less water evaporation, if you wish. Like there's more of that water loss not happening. So it's like, I think this would be really good because it also does this, this, and this, right? So I think we need to take our blinders off a little bit. And it comes with time and experience. And I'm challenging those that have a hard time with this because maybe you've been doing lashes. It's a lash season right now. Grads, I don't know, weddings, special events, all these things. So you're not, maybe your head's not in that section right now. But, if you can try to keep talking about it, if you have a lash client, you don't have to talk about lashes.
Mhm.
right? You could be talking about something else. So sometimes it's doing your own survey on the client. You say, so I notice you're a little bit red. Like, do you have sensitive skin? And that I start a conversation with them in the middle of a pedicure, right? It's okay. So a couple ingredients that we came
Yeah,
across.
tell us the ingredients.
Yeah. So okay, so sensitive skin, hyaluronic acid. We all know about hyaluronic acid. So it's a humectant, so it helps to bind moisture to the skin. However, you need to have the moisture in the skin for it to bind to. And a lot of people don't realize, they just say, I use hyaluronic, it doesn't work. And it's a common question. I've heard it from professionals. So, but why is it not working? So ask yourself that. It has nothing to bind to if you're dehydrated,
Mhm.
right? So you need to, can you suggest that they splash water on their face or dab their skin dry, not wipe it dry? Don't wait too long. Like when you come out of the shower, let's say, I will actually use my lotion slash toner and I'll splash it on to my face and then use a hyaluronic on it to help. Do you mix your serums, right? So, anyways,
Yeah,
there's,
I have a spritzer that I spritz
yeah,
my face first,
it's
and then
perfect.
I put my hyaluronic on.
Yeah, it's a great thing. Glycerin is a humectant that helps to bind moisture. So people think glycerin is like the other glycerin, like in lip chap and things like that. But there's different levels of it. But yeah, that's why is that in there? It's to seal the moisture in. So it's the same concept of why it's in your skincare. Ceramides, which I mentioned before, it's an emollient to help prevent that transepidermal water loss, or you'll hear it as 12, TEWL. And most of them are like that. So, like fatty acids is another emollient that helps prevent that water loss in the skin. I think we even did one on niacinamide, right?
Mhm.
So, niacinamide, we know it's an antioxidant, anti inflammatory, but it's also because of that, when you think sensitive skin, usually has an inflammatory response, right? The sensitivity. So, niacinamide, even though it's circulatory, like vascularly going to lighten up the skin, but it's also going to bring down that inflammation. We kind of talked about that too, right? So it reduces the oxidative stress in the skin because you're bringing the circulation to the surface. What else is on the list? Let's see here. I've got a list for you guys. Okay, vitamin C, antioxidant. Well, we know it's an antioxidant. Everyone talks about that very, very quickly. But when it's mixed with the ceramide, it's formulated at a higher pH. So it discourages the oxidization of the skin, which causes damage, which is going to optimize the immune system, which is going to help if you're optimizing the immune system. This is another topic. We'll get into that, but not today. But, anyways, it actually helps prevent that inflammatory response as well, which is really interesting because we only think of vitamin C. I need to use a vitamin C because it's an antioxidant. But
Mhm.
why do you need to use the vitamin C? I think, yes, it's an antioxidant, but what's more going on? So these are little tidbits you could add to your verbiage when you're speaking to people, and hopefully that's going to help. So, you want to look at the little bits of how can you expand on your knowledge, because then they're going to be like, oh my God, wow, Dream, like Dream knows all this stuff. This is so neat. I'm going to ask her. So you become like a resource, and it's okay. You don't have to know everything, right? You'd be honest, say, oh, that's interesting. I haven't heard that yet. Let me look into that and I'll get back to you. As I always say, follow up
Yeah.
with and get back to them, right? What else is on the list? Actually, interesting enough, one came up as retinols. It's a better choice for sensitive skin. I mean, yes, the doctor's office or your medical or maybe your professional could be stronger. So you got to think, what level of retinol are you using? So you don't want it. You want it to be lower level, but it's a lot more gentle on the skin at a lower level. So you still have the sloughing, but not extreme. So, people think if I do a peel, it'll help. But at the same time, when you're using it, you got to think about less is more. Like do
Mhm.
it a little bit. So you help slough off that dead skin and then you use your other ingredients to it to help. I mean, diet's another one, which I really want to do a topic on the nutritional side of things for gut health. As we know, our gut is an immune system, so is our skin. I mean, there's so much correlation between it all that they're finding. Any comments at all, Doreen, before I keep going?
Well, I think with the ingredients too, like you had said about, knowing your ingredients or whatever, just having this list of ingredients and then going through the product that you work with and seeing which ones have it. Can you mix and match? What
Mhm.
can you like custom
Technology. Yeah, it's that
yeah,
next.
customize
Yeah.
yourself, right? Knowing the ingredients, because I think part of doing that helps set you apart as well, in that you go that extra step.
Mhm.
I came across a comment on on Reddit. It's from an esthetician, and she was saying how she wanted to become a skincare expert. But early on in her career, she got a lot of waxing clients and she just did a lot of waxing. And now she really wants to focus on skincare and how she's asking, how do I do this? And one of the comments, which echoes what we always say, is learn the ingredients. Learn the ingredients of your products that you're using. And this is part of it. Like, you don't have to know them all. Go through the list, compare it to what you have, and select a few and have those in your back pocket as these knowledge bits that you have. This is my what I default to. But if I need more, if it's not working, then you can go back to the bigger list and see, okay, how can I incorporate something different? It's a slow, like, if somebody doesn't know this, to hear that list would be like, oh, that's a lot, but it's, you
Mhm.
don't have to consume it all at one time, or just,
Right. Mhm.
take it in a bit at a time, bite size.
Right, and it comes with time and experience. I mean, it's like I already know that side of it. I've been doing this for over 30 years. I didn't know that at the beginning, but I got curious and I asked why. And then it was like, oh, if vitamin C does this, that makes sense, but why? What else does it do? So it was just curiosity all the time for me because I wanted to know more about it. But that's something that, like I said, it's very difficult unless you plan to study every day, but when it comes to client, now it's like, well, I want this product with this product. It's like, oh, wait a minute, this has this in it. Interesting. So then I grab it and then I research the product a little deeper and go, actually, this would be really good for this type of skin when it's actually not technically maybe made for that, right? There's a few lines that do a very good job of educating people on those things. And I think it's important. It'll help you. So get curious with it if you want to become an
Mhm,
expert in this and be the resource to it. The other thing that came up, a very important component, was our body's health overall, which is another part. And they talk about minerals, which you don't hear a lot about in our industry, right? You might
mhm,
see it a little bit in skincare to some degree, but some ingredients for the body itself. And this is where I would refer them and say, have you talked to your pharmacist? Because you know what medications they're on. Because if you
mhm.
start getting into minerals, you don't want to say, oh, you should be taking zinc because it does this, this, and this.
Oh, yeah, like
You can,
internal you're talking about.
yeah, yeah, or whatever. Maybe it's the food that you're eating. You're eating more broccoli now because of,
Yeah.
or it's like, but do talk to your pharmacist or tell your client, refer to your pharmacist and say, you know what, because you take these medications, I don't want them to contraindicate each other because they can cancel out. And that's what people don't realize when you're taking any kind of vitamins, minerals, or whatever, that it could affect their medication. So I just say, well, I understood that zinc's really important. It's a healing mineral.
Mhm.
You give them the information, but send them to the resource so that
Yeah.
not a
Never
doctor, you're just
prescribe.
giving.
Don't tell
Yeah,
them to take it.
that's right. No prescribing, which we always say, don't prescribe per se, the
Yeah.
outside of your, what's the word I'm looking for? There's a word for
Open
it.
practice.
Scope of practice. That's the word. Thank you. Yeah, so they actually also say that calcium, trace element found in relatively large quantities in our body, which we know with the skin actually helps because it helps with the renewal side of the benefits of the barrier of the skin, which is interesting because if you're eating food, I mean, the old saying is you are what you eat. So how do you nourish yourself within as well? So this is why if you want to become more involved, you're not, unless you take courses on nutrition and things like
Mhm.
that, then maybe you can talk more freely about that. But if it's not your thing, and that's okay, refer them to someone that could be, you know?
But eating broccoli, more broccoli is always a good thing, so I don't think that can be bad.
Well, some people don't like broccoli. They don't like kale, they don't like broccoli. It's like, well, how are we going to get those greens in you?
Yeah, well, there's the what is it? No pain, no gain.
Right.
Suck it up and eat it anyways.
Are you eating because it's what you like and love, or are you eating it to nourish your body? So it's tough
Exactly.
sometimes. If it doesn't go down, that's how I feel about liver.
Put hot
Supposed to
sauce
be good
on
for you, but I'm like, I'll find another resource for that one. Thanks.
it.
Another one that came up is selenium, which is trace element important for DNA, and it's said to help protect your skin from oxidized stress on the skin. So again, antioxidant, but understanding a little bit more about it. And copper, this mineral helps to keep skin strength and elasticity, and it actually enhances other antioxidants, which I thought was really interesting
Oh,
because some of them work on a different way. They actually help other ones. So anti-inflammatory, antioxidant effects, and it's great for regenerating sensitive or damaged skin. So sometimes out there they're talking about the probiotics world as well, but there could be other things that you already have in your products that probably will be helping. So again, jumping on the trend is one thing. And I hate to say that's a trend because that's scientific. That's not a trend per se. They're just discovering more things, but people are talking a lot more about that, which also is gut health. So there's many
yeah.
things to
It
that.
always goes back to the gut. But I think some of these, like I just Googled like copper. How do I get it in food? You might be consuming some of this stuff. Like some of it's like oysters or shellfish, but there's also whole grains, beans, nuts, potatoes. Like it's in your food too. So not necessarily have to take an extra supplement as much as like maybe focusing on what you're eating.
Right.
But again, you're not a dietitian as an
Mhm.
esthetician beauty pro, like you could just share knowledge and your clients can look it up themselves too. I had a client who was
Hmm.
very invested in her skin health. Like she was doing lots of her own research because she was wanting to, figure out how to help herself too. So I think you end up becoming a team with your client too, especially those that are dealing with something that they really want to
Mhm.
target.
And when that happens, guess what? They're giving you information that you
Absolutely.
can
Yeah.
share. I did that. Oh, I have a client who actually, went to her doctor and they discussed it, and this is what the doctor said.
Yeah.
So maybe you want to talk to your doctor about it. Like, right. So then you're not the person, you're just offering extra information. It
Absolutely.
doesn't have to be just held to you and you're only going to be that way with your clients. So if you want to be that expert skin specialist, then what do you need to do to get there? And this is just an idea, like resources. We're trying to give you ideas. Sensitive skin's a big one out there. It's younger and younger. Sunscreen is
Yeah.
huge part of that, which we know, but that'd be the
Of
first step.
everything.
Yes.
Huge part of everything. I think this topic about sensitive skin, it's really a good way to go about for anyone who wants to be more focused on being a skincare expert, looking at it from concern perspective, like, right? Sensitive skin. Now what do I need to know? Now, like that might help
Mhm.
classify it a bit for how your brain likes to work. I don't know,
Yes. Yeah,
depends, right?
it's
Instead of just
true.
learning ingredients and trying to place them with a concern, learning the concern and then understanding the ingredients that work for that.
And another on that, like when you think about sensitive inflamed skins, who else has that? Acne,
Mhm.
right? So that like people like, oh yes, that's right. So you really got to try to find ways to get the blinders off and get curious and ask the questions why, but what if? And I mean, my gosh, you got Google. Not that it's all, you got to be careful of your resources for
Yeah.
sure. But in the beauty world, there's a lot of great companies out there have been doing it for a long time and they get everything. They got topics on business, skin, education, like the latest and greatest and interviews and blah blah blah. But there's like Skin Ink, there's Dermascope, there's even more, I'm sure, but there's a lot of resources from it. And that's what happens. I start getting curious, or what are the questions people are asking, or who they're asking me. This came up because I was just did my rounds of education supporting some of our accounts when in Calgary. And this came up. And when I said, well, what do we define as sensitive skin? And everyone goes to the rosy cheeks. It's like,
Right.
okay, but sensitive and inflamed. Okay, rosacea. What else is there? And then they're like, oh, I never looked at it that way because they're only going by normal, sensitive, oily combination, dry skins, right? So, but there's conditions, and a lot of conditions overlap each other. So that's why I thought, oh, this would be an interesting topic. If anyone's got any other topic or conditions that they'd like us to discuss, please let us know.
Absolutely. We're always open to getting those messages and requests and we can do an episode on it. Awesome. All right. Well, that's it for us this week and we'll be back with another one next week. Thanks for listening to Beauty Babble.